Hello and good afternoon. Thank you so much for joining us today for our March coffee chat. Our topic for today is promoting healthy beverage consumption among school-aged children and adolescents, new expert-backed recommendations. My name is Molly Garrone. I am a senior communications coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health, and I will be moderating today's discussion. First, I would just like to give a bit of a disclaimer that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we're not looking to influence any specific legislation. I also want to note that myself and our guest speaker today are sharing personal perspectives, and we do not speak on behalf of Harvard. For today, we will start by hearing a presentation from our speaker, and then we're going to be opening it up for a full group Q&A. But please do feel free to share any questions or comments in the chat at any time. The presentation today will feature an overview of the new expert-backed healthy beverage recommendations for school-aged children and adolescents. Our guest speaker will specifically be walking through these recommendations and also sharing resources that can be used to provide guidance for parents, caregivers, and public health professionals. So I am thrilled to introduce our guest speaker for today, Megan Lott. Megan serves as the Deputy Director for the Healthy Eating Research Program, also known as HER, and is based at the Duke Global Health Institute at Duke University. In this role, Megan manages day-to-day program operations, oversees coordination of scientific and administrative processes of HER-funded research, engages in policy and advocacy collaborations with key partners, and identifies research priorities to advance program goals. In her 10-plus years with HER, Megan has overseen 7 expert panel projects, including the 2019 Consensus Project to develop healthy beverage recommendations for 0 to 5-year-olds. Megan is a registered dietitian with a Bachelor's of Science in Nutrition Sciences and Dietetics from the University of Cincinnati and a Master's in Public Health from the University of North Carolina at Chapel Hill. So welcome, Megan. We're really lucky to have you with us today. And without further ado, I'm going to give you the floor, Megan.
Thanks, Molly, and thanks so much to all of you for inviting me to join you this month. I'm really excited to talk to you about these new guidelines. If we can jump to the next slide. So just a little bit of background on why we decided to do this project. So probably not surprising to many of you, but there are so many new beverages in the marketplace all the time. And this has really created a lot of confusion for consumers over health benefits and risks of each beverage. And many of these new beverages contain added sugars that we know contribute to risk of overweight, obesity, and diet-related chronic diseases, such as dental caries and type 2 diabetes when consumed in excess. And there's been an increase in beverages that contain non-sugar sweeteners, caffeine, and other ingredients with purported health benefits, but we don't actually know if they do have the health benefits many claim. We also see as children age, there's this increase in autonomy over the purchase and selection of foods and beverages. And when you pair that increase in autonomy and still very rapidly developing brains when it comes to decision making, plus this increasingly crowded beverage landscape, kids, adolescents, teens, and tweens in particular, are just overwhelmed with the amount of choices they're facing at home, school, sports, parties, and other social gatherings. So while there are some recommendations out there for healthy beverage intake in school-age children and adolescents, we found a lot of important gaps in this information. Recommendations were not consistent in the types of beverages they discussed. Many newer and increasingly popular beverage types were not addressed at all. And then there were also inconsistencies in aspects of recommendations. So for example, how much water to drink or how much juice to limit at different ages, which really contributed to confusion not only among parents and families, but also even among healthcare providers, other practitioners, et cetera. And so we'll talk more about that issue later, but a big goal for us was really thinking about how do we reduce this confusion and come up with sort of one set of guidelines that would be used across healthcare settings, but also make it easier for children and families to make healthier decisions as well. Next slide, please. So The 2020 to 2025 dietary guidelines for Americans recommend following a healthy dietary pattern at every age, which includes choosing nutrient-dense foods and beverages and limiting foods and beverages high in added sugars, saturated fat, and sodium. Sounds easy, but when you break it down and look at all the foods and beverages consumed to meet food group recommendations, the DGAs really assume that individuals are making the most nutrient dense choices to meet food group recommendations. And this ultimately leaves a very limited number of calories for other uses. So, what we commonly call discretionary calories or foods and beverages that are not nutrient dense. Except for milk and 100% juice, which fall in the dairy and the fruit and veggie categories, all other beverages fall into discretionary calories or calories for other uses. Then DGAs takes it another step further and says that SSBs or sugar sweetened beverages are not a necessary component of the diet for children and adolescents and should be avoided. So that's kind of what the dietary guidelines are saying or putting out there. But we know most children and adolescents in the US don't meet the DGAs. We know they underconsume fruits and vegetables, they overconsume added sugar, sodium, and saturated fats. And while sugar sweetened beverage consumption has or did decline steadily from 2003 to 2018, this was really driven largely by declines in soda and fruit drinks. But at the same time, we started to see increases in consumption of coffee and tea-based sugar sweetened beverages, especially in the adolescent group. So where we are today, overall, sugar sweetened beverage intake remains high, and we still see disparities between children of various race and ethnic groups. For example, rates of decline for soda and fruit drinks were lower among non-Hispanic Black children compared to non-Hispanic white peers. Next slide. So, given the importance of beverage consumption throughout the lifespan, especially in childhood and adolescence, healthy eating research decided to convene 4 national health and nutrition organizations. So, the Academy of Nutrition and Dietetics, the American Academy of Pediatric Dentists, the American Academy of Pediatricians, and the American Heart Association to develop comprehensive evidence based recommendations for beverage consumption among children and adolescents ages 5 to 18. Next slide. Some of you may already be familiar with the consensus recommendations for what young children ages 0 to 5 should drink as part of a healthy diet. These were developed by the same expert panel of organizations, so same 4 groups, and were released in 2019. We won't be discussing these recommendations in detail today. However, I did want to note that the report and recommendations for the 0 to 5 age group is available at healthyeatingresearch.org, and it's important to note that the school age recommendations we are discussing today pick up where this report left off. So 0 to 5 was really meant to be birth through early childhood, and then the school age picks up sort of at kindergarten when kids enter the elementary school system and goes through senior year of high school. Next. So as I mentioned, the main goal of the project was to convene an expert panel of representatives from these key national health and nutrition organizations and develop a consensus statement on what children and adolescents should be drinking as part of a healthy diet. Ultimately, our goal was to get to that one uniform set of recommendations that cover all beverage categories currently available in the marketplace, and that whether you're going to your pediatrician or seeing a school-based nurse or going to the dentist, you are hearing the same information and same recommendations from a variety of health providers. Next. So I could give you an entire hour-long presentation on just our methods alone. I'm going to just distill it down to this one slide, but if you have questions, I'm happy to answer them. The development of these recommendations really breaks down to these 5 steps. So our first step was to convene our expert panel and scientific advisory committee. Then once we had that done, we reviewed existing recommendations. So we looked at more than 50 recommendations from authoritative bodies. So that's groups like the WHO to USDA National School Lunch Program, Child and Adult Care Feeding Program. What are other existing recommendations out there through the 4 orgs that participated? You know, what is their current clinical practice guidelines at AAP or the Academy of Nutrition and Dietetics that providers are using? We then identified where there was alignment or not among existing recommendations and used that information to inform a series of research questions and broke down into 4 working groups. So the 4 working groups, we had 1 working group on water, 1 working group on milks, which included regular milk, flavored milk, and plant-based milk alternatives. Then we had a work group on sweetened beverages, which included 100% juice, sugar-sweetened beverages, and beverages with non-sugar sweeteners. And then finally, the 4th group was quote unquote other beverages, which were beverages with additives, supplements, and caffeine. Each of those work groups conducted a series of literature reviews and then developed, based on the findings from that literature, a set of recommendations that they brought to the full group, where those full set of recommendations were discussed and deliberated among all representatives, and finally resulted in the final consensus recommendations. Next slide. So a little bit about the expert panel itself. So Healthy Eating Research invited 2 experts studying beverage consumption in 5 to 18-year-old children to co-chair the expert panel. So many of you may know Angie Craddock here from the Choices Project, and her co-chair was Anisha Patel. We then invited a research consultant with expertise in nutrition and public health to support the expert panel's work. So this individual worked very closely with Angie and Anisha and the HER team to do all of the behind the scenes research. And then each of the 4 organizations were invited to participate in this expert panel process due to their involvement in the previous one released in 0 to 19, developing recommendations in early childhood. Each of the 4 organizations appointed 2 representatives, and one person was meant to be a member content expert, and the other person was someone who could speak on behalf of the organization. So in most cases, this was typically a staff member from their science team who also worked on these issues. And then the other thing I want to point out is that we also invited 9 scientific experts for their scholarship on beverage consumption in children and adolescents, or their experience in establishing dietary guidance from diverse disciplines and backgrounds, to join a scientific advisory committee. Now, the goal of the Scientific Advisory Committee was really to provide input throughout the consensus process on the panel methodology and protocols, including providing feedback on the background research, lit reviews, and the final consensus recommendations development. And they did review the final recommendations for scientific rigor and accuracy. We kind of looked to the SAC to be our, quality control mechanism throughout the process. Next. So multiple meetings were held with the Scientific Advisory Committee, actually prior to even pulling the expert panel reps together to review our process and methods, pre-literature reviews, to make sure that we developed sort of a standard protocol we were using across all 4 work groups and with all different beverage types. It took us a long time to figure out how we even wanted to categorize some of these newer beverages that didn't cleanly fit into more, or that fit into more than one category. So we had multiple meetings with the Scientific Advisory Committee, and then we also had multiple full group meetings, which included expert panel plus scientific advisors, and then we had multiple work group meetings. So we all met over a period of 5 to 6 months, but it's hard to quantify the exact number of meetings because there were so many different subgroup meetings happening throughout the process. We also used Qualtrics surveys at key decision points and after full group meetings to get additional expert panel member feedback on recommendations and literature reviews throughout the process. So one thing I do want to mention is that each work group did review the literature on their specific beverage sets and then put forth their draft recommendations for their beverage categories to the full panel plus the Scientific Advisory Committee for consideration. And so that is a lot of what was considered in the final meetings that we had as a full group. Next. So this is, as I mentioned, the final recommendations and supporting rationale were reviewed by everybody. They were then incorporated once we kind of got to consensus on the language itself. They were then put into a consensus statement and supporting technical report, which were reviewed by the 4 orgs. So the consensus statement is what we call sort of our shorter executive summary. It's not really short. It's about 20 to 25 pages, but does kind of give you the highlights about our rationale behind each recommendation and what went into it. The technical report is closer to 150 pages. And for anyone who really wants to get in the weeds, it's a very long but great read on all of the evidence we reviewed and all of the additional issues we considered as we were reviewing the evidence. Ultimately, the 4 orgs had extensive review processes that each of these documents went through, which started with the org reps, but then went on to relevant scientific committees, and finally, in some cases, approval by the leadership and even in some cases, different segments of their board. And then these two products were finalized after full consensus was reached by the 4 organizations, the advisory committee and HER. And so thank you, Angie, for putting the link to the recommendations in the chat. Highly recommend you check those out. Next. So this is our summary table of the final recommendations. And so one of the things that we haven't talked a lot about yet is with plain drinking water, it led us to this conversation about total hydration needs. One of the things we heard the most from the different groups was that when they are seeing families, parents are always looking for guidance on how much should my kid be drinking each day to avoid dehydration. And so while this wasn't it didn't follow the standard literature review all of the different beverage categories did, we did spend some time working with adequate intake levels and reviewing previous federal reports on this topic, and came up with sort of recommended beverage ranges for each age group for total hydration needs. And so that's the very top bar or top row you see on the screen in the dark green. This is really the total amount of fluid your child should be drinking each day to avoid dehydration. Now, these ranges or amounts are not an upper limit. They are an average. It's very important to note that individual needs for hydration and drinking water are going to vary from child to child based on body size. And as children age, they vary based on biological sex, and they vary based on activity level and climate. So if you are a high school athlete doing 2-a-day practices in the South in August with 100% humidity, you are going to need more fluid than this to avoid dehydration. And we go into a lot of detail on this in the report, but really wanted to provide some of these ranges to give parents an idea of what they should be aiming for. And so the beverages to drink are plain drinking water and plain pasteurized milk. And those are the categories that have sort of recommended ranges or upper limits. Then in beverages to limit, we have 100% juice, which is really there because we'd prefer children meet their daily fruit group recommendations by eating whole fruit, where they get more nutrients and fiber that is lacking in juice. But also here, plant-based milk alternatives, which may be appropriate when medically indicated, but generally the research is very strong that these plant-based milk alternatives are not a sufficient one-to-one nutrition substitute for animal, in particular cows-based milk. And so a lot of families, what we found, were swapping them out one-to-one, not realizing they were not nutritionally similar or adequate. So that's a message we wanted to drive home through these recommendations. And then sweetened flavored milk is here because while flavored milk does still contain some of the nutritional benefits of plain pasteurized milk, many people don't realize that a lot of flavored milks have as much sugar as a 12-ounce can of soda, and often more sugar than a similar amount or 12 fluid ounces of a sports drink. So knowing that our kids are over-consuming added sugar throughout their day, and we have data from school meals showing that chocolate milk is the #1 source of added sugar in elementary school kids' diets, we really wanted to put sweetened flavored milk here in this category of limiting. And we really frame it in the technical report as an absolute last resort. If your child does not like plain milk, for example, we recommend going towards unsweetened yogurt or low-fat cheese as opposed to going to flavored milk. This is an absolute, my kid won't drink anything else sort of scenario. And then finally, in the beverages to avoid, we have sugar-sweetened beverages, beverages with non-sugar sweeteners, and beverages with caffeine and other stimulants. Next. A couple of other things I wanted to flag is that we also looked at several other considerations while we were reviewing the evidence. So these were additional topics that might play into individual beverage choices and/or policy systems and environmental strategies to change behavior and policy. So for example, we wanted to ensure that our recommendations were relevant for families living on limited incomes and/or below the poverty line. So we looked at budgetary considerations and addressed those in the report. We also worked to look at the literature and our recommendations through a lens of cultural relevance and cultural humility. Unfortunately, not every study provides detailed race and ethnicity population breakdowns. And when they do, we find that they're heavier weighted towards white Americans. And so this is something we really looked at and put a very intentional lens on as we were developing the final recommendations through message testing. And I'll talk a little bit more about that. And then environmental implications, of course, like single-use plastic containers in the individual serving sizes or input packs of animal milks versus plant-based milk alternatives, for example, on the environment, were issues we also reviewed. And then finally, other influences like marketing to kids, we know weighs heavily on their individual decisions. Next. So the report also explores possible policy and practice recommendations or applications for the recommendations. These recommendations just came out in January, so I don't yet have a lot of examples where these have been integrated into practice and policy. However, because the 0 to 5 recommendations came out in 2019, we actually have quite a few examples where the recommendations have been used to impact policy and practice. So for example, following release, we worked with all 4 of the involved organizations to change or update their clinical practice guidelines. So now when a pediatrician or a dietitian or a pediatric dentist is looking for recommendations on what they should be counseling families on, they are fully aligned with the 0 to 5 beverage recommendations. Similarly, we were able to work with a research team out of Wake Forest University to develop 2 SSB screener questions that now have been integrated into the electronic health record via Epic. And so any health system using Epic can actually go in and turn these SSB screener questions on behind the scenes. And Wake Forest is a great example where they've been using those screener questions to trigger interventions and capture consumption data. They're also now exploring linkages with WIC and with WIC records, which is really new and exciting. Additionally, we've been able to get educational guidance and materials uploaded through the WIC nutrition education system, like WIC Works and the National WIC Association Resource Library, as well as through SNAP-Ed resources. So right now you can find all of the 0 to 5 resources in those places, and we'll be working to update the SNAP-Ed library with the 5+ recommendations in the coming months and year. And then we'd love to hear more from you as well about other opportunities to implement these in local or state policies and programs, and or if you're familiar with the 0 to 5, how you've been using them. We know they've been used in a lot of clinical settings as well. Next. And then one thing I want to mention, I briefly alluded to it earlier, is that we conducted focus groups in the summer of 2024. And a big point of why we did this was because we saw a real gap in the published literature among racial and ethnic minority groups and we wanted to do some message framing with a diverse audience to see, do they see themselves in these recommendations? Do they feel like they apply to their lives? So we did a series of focus groups with parents of varying racial ethnic backgrounds. So we did, low-income white Americans, Black Americans, Hispanic Americans, American Indians or Native Americans, and Asian Americans or Pacific Islanders. And then we also did a series of focus groups with tweens ages 10 to 13, and then adolescents ages 14 to 18 to get their input on the recommendations as well. And a lot of the final materials we developed are very reflective of their feedback. Next. So as a result, we developed a ton of materials. So the next couple of slides, I'm just going to highlight those. So we have the consensus statement and technical report, which I've already discussed. We also have a series of handouts or fact sheets, infographics, social media graphics that are all available. We have a provider toolkit, which is really primarily geared towards health providers who would be using information in counseling. But we also have a partner toolkit that is really helpful for sharing the recommendations broadly. And then we have resources for parents, and this is really mostly highlighted on the Health Eating Research website, which is our most parent-facing resource. We also have translated all these materials into English, Spanish, Vietnamese, and Tagalog to make them more acceptable or more available for different populations, and would love to hear from you all if there are other languages that would be helpful as well. And then next slide, please. Sorry, there's some of the different languages of the same infographic. And next. And we also developed this interactive tool for meeting daily fluid needs. So this is a really fun thing that is available on the website, which for each age group, you can see ages 5 to 8, 9 to 13, and 14 to 18. You can move the sliders around and it will automatically adjust the amount of water based on how much milk or juice you put in to meet your child's daily hydration recommendation needs. Next. So, a big part of our initial release was really just focused on getting the recommendations out there, increasing awareness. In the coming year, we'll be working more on those policy and practice changes, as I mentioned earlier. We've had a lot of success initially. So, these were released January 29th of this year. In the week following release, there were more than 47 pieces of coverage with an estimated 2.89 million views of coverage. We had them or highlighted on a segment on the Today Show, which was really exciting, and had online articles on a number of very prominent health news outlets, and then have had a really great turnaround with social media. We were able to engage some influencers to help enhance awareness among parents. And then we've done a lot of partner outreach, as I mentioned, with that partner toolkit. We've been working with model comments for the 2025 to 2030 dietary guidelines for American Scientific Committee report to reference these. And we're looking for other opportunities to do similar work. And I believe that is my last slide before we jump into Q&A.
Awesome. Thank you so much, Megan. I really appreciate this was such a great overview that you gave here, touching on all the methods and the time and careful considerations that went into the development of these recommendations. I think it was also great to hear about how you touched on policy and practice implications, message testing, and all those awesome resources that I know are particularly helpful for folks in this audience. And great to see here and hear about all the media coverage and engagement that you've had so far. So thanks so much for a great presentation. So we are going to move to a Q&A portion of our event. But first, we wanted to ask another poll question. So I think we're going to put this question in the chat, and we're looking for folks to respond in the chat. So get ready to share your responses. And so we're wondering if there are additional resources for working with families that you're not seeing that would be helpful to create. So ponder that for a few moments and share in the chat. I know Megan also just mentioned a few moments ago about additional languages. So the materials are available in multiple languages, but if there's other languages that people can think of, you could also include that in the chat too. And actually, I do see one comment. So this is great. Thank you. So Christina shared perhaps something for teens about targeted marketing from drink companies. This approach seems to resonate with that age group. Any comments on that, Megan?
Yeah, what's really interesting is we also had another expert panel that was kind of ending at the time this project was beginning. And that expert panel was actually on digital marketing to youth of foods and beverages. So that report came out in the fall of 2024. And one of the things that we found that was super fascinating through that research was when you talked to teens about digital marketing strategies and companies that were targeting them, or even, this influencer has been paid to promote this product and they're self-proclaiming that. A strange thing happened. Teens trusted that source of info more. They felt like they were being honest with them. So if the influencer said I was paid to promote this drink, they thought, oh, this person's really trustworthy. They're telling me. Or, Coke is targeting you with this ad. Oh, interesting. They must want, it didn't have the desired effect that was hoped for, which was that it would show them that they were being manipulated. And so this is an area where I think there's a lot more work to be done to figure out how we can best educate teens and tweens about this, because you're absolutely right. The targeted marketing that is hitting them, especially with these caffeinated and sugary sweetened beverages for adolescents, is just really overwhelming. So figuring out how we can better inform them about the dangers and that the targeted marketing is a form of manipulation, that is not something to enhance trust, the better. I just don't know that we have the right answer there quite yet for that one.
Great. Thanks again, Christina, for sharing that. And thanks, Megan, for talking a bit about what you've been finding on that topic. I think that's great for people to hear. And other great ideas here, resources created by the youth or something youth would be interested in sharing with their friends. I think that sounds great. Posters for pediatric offices, ideas for participatory activities at community events. Great suggestions. And Meg shared additional languages that could be helpful: Arabic, French, Portuguese, Somali. So wonderful. Any comments, Megan, or shall I move to our Q&A?
These are great suggestions. I think we'll definitely note them and love to explore some other things we could add to that partner toolkit based on these ideas, but I don't have any other comments yet.
Great. Yeah, these are fantastic. So keep them coming, folks. This is great. So one question that I have here, so we do see a lot of different recommendations out there, and I know other groups have issued recommendations before on healthy drinks. What makes these recommendations different?
So if we can pull up slide 28, which was not part of the original presentation, I mentioned earlier in the methods that when we were doing our initial review, the first step we did was review existing beverage recommendations. And so we looked at more than 50 source documents, so more than 50 sets of existing recommendations. The only group where we found a generally well-established recommendation with broad agreement on whether or not the beverage should be consumed, so that would be consumption, the type of beverage, the frequency, so, how many times per day or how many ounces per day, and then the amount was with sugar sweetened beverages. There was broad agreement that kids should be limiting or avoiding sugar sweetened beverages in their diet. But for every other beverage type you see here, and they're ordered from top to bottom, where we had the most consistency and completeness to the least, there were discrepancies or limited evidence or lack of agreement on either whether or not the beverage should be consumed, the type of beverage, frequency, or amount. So even with plain drinking water, we didn't have consistency in the amount kids should be aiming for each day or on water subtypes. So, like, where does sparkling water fit in? Where does flavored water fit in? Are those part of the plain drinking water category or are those different? So, we really spent a lot of time in the beginning looking at this and then breaking down how are we going to define each of these beverage types, which subgroups are included or not, and coming up with recommendations around each of them. So, I think this slide is really meant to just give you a snapshot of how I think our recommendations are different is that we are now aiming. We think that our recommendations, they're consistent, they are complete. We address all four of these: consumption, type, frequency, amount in our final recommendations. And we coverage all of the beverage types you see on the screen. So those, for example, in the lowest consistency and completeness, like sweetened flavored milk, beverages with non-sugar sweeteners, or beverages with caffeine, there's broad disagreement on where to put flavored milk across all existing recommendations. There were a lot of recommendations that didn't even address non-sugar sweeteners or caffeine among kids. So our recommendations do now address all of these nine categories. I had to recount, and all of these sort of quote unquote criteria for each.
Awesome. Thanks for clarifying that, Megan. Appreciate it. So I see some questions in the chat, which is great. So keep your questions coming, as well as any responses to that poll question from before. But I see one question here. This is likely more applicable to high school age students, but what would your response be to the use of chocolate milk as a recovery drink after workouts? This is marketed here in Wisconsin. And in full disclosure, my go-to after workout. So thanks for the question, John. And any thoughts, Megan?
Yeah, so we definitely tried to look at these recommendations from a population health level, daily consumption, but it is important to note there are a few caveats. So even though sports drinks generally fall into sugar sweetened beverages and or the category of beverages with other additives, we do have a caveat in the report that for people engaging in vigorous physical activity for 1 hour or more, so we're talking like running long distances in high heat and humidity for more than 1 hour, or engaging in intense physical activity for more than 3 hours. So as a an aside, like those high school football players that are competing in two-a-days in the heat of August probably need a sports drink or a chocolate milk. I would recommend my kids drink that over a sports drink, for at least it has the positive nutrients in a plain milk, versus the additives in the sugar or the sports drink, which is mostly added sugar and electrolytes and some other additives we're not really sure we know much about. Um, but my 8-year-old playing a 1 hour soccer game is fine with just water. My 12-year-olds who go play a 2 hour tennis match, in most cases, are fine with just water. Sure, there may be some extreme conditions that would warrant other things, but the key takeaway message here is that the average child playing outside, doing recess, or even doing, you know, rec sports leagues do just fine with water as a recovery drink.
Great. Thanks, Megan, and thanks. Great question. So I see another one here that is great. I think we already had this question on our radar about how the recommendations land on either really low calorie or no calorie sweeteners, and I think also, drinks that maybe say they're sugar free. Is that okay? So any comments on that, Megan?
Yeah, so there's definitely a lot of beverages in the marketplace these days that fall in the no calorie sweeteners or low calorie sweetener bucket. So whether it's something like a G2 Gator, the lower sugar Gatorade, which has some low calorie sweeteners, or non-sugar sweeteners paired with real sugar, we're seeing this happening in a lot of different beverages, from fruit drinks to sports drinks to other pieces. And the reality is there is not a lot of research on the impacts of these non-sugar sweeteners or low-calorie sweeteners on children and adolescents. And the evidence we do have on adults, we're starting to see emerging evidence showing that not only are these non-sugar sweeteners not providing the weight maintenance benefits we originally thought that they were providing, but there also might be some cause to suspect harm. So we are seeing that they are now being tied with increased rates of heart disease, certain types of cancer. There are certain of these non-sugar sweeteners that are under additional review at FDA for these reasons. And the bottom line was the expert panel felt like, given the lack of evidence in children and adolescents, paired with the fact that this is a time for rapid development of bodies and minds, plus the emerging evidence in adults, that it was their expert opinion to really take an approach of caution and recommend that all children and adolescents avoid all non-sugar and low-calorie sweetened beverages. And the reality here is it doesn't have to be a choice of like diet soda, or this non-sugar sweetened beverage and a sugar sweetened beverage. There are other options. There's water, there's milk, there's juice, there's ways to enhance water by putting fresh fruit in it. So it's not just a black, white, is it non-sugar sweetened or sugar sweetened beverage? There are many other alternatives as well.
Yeah, great question. And we're sharing a slide as well that gives a little more context into what Megan was sharing. But I appreciate that, Megan, and thanks for kind of telling us what the research is showing, but also that reminder that there are many options for healthy drinks. So to keep that kind of as a key message when communicating about this. So thanks for the great question, Kathy. And then Christina asked another question that I think is a really good one. Curious about why unsweetened soy milk was in the category of beverages to limit, because it has some, nutritional similarities to milk, and there are folks out there with, lactose intolerance or, inability to digest lactose. And so curious, Megan, your considerations on that.
Yeah, so I believe actually slide 36, we have a similar slide here on plant-based milk alternatives. So one thing that's important to note is that we, in our recommendations, and we go into much more detail in the consensus statement and the technical report, we do include or recognize unsweetened fortified soy milk as an alternative that meets dairy group recommendations. It's the only plant-based milk alternative recommended or acknowledged by the dietary guidelines for Americans to sufficiently meet the same nutrients as cow's milk. That being said, in reviewing the other source documents, like the new guidance from the child and adult care feeding programs that were updated in the past 5 years, as well as National School Lunch Program, they don't specifically recognize a plant-based milk alternative type anymore. They now say plant-based milk alternatives must, at a minimum, meet these nutrition categories. And so it has limits for protein, calcium, et cetera. And that's largely because we are starting to see other products on the marketplace, like the pea milks, like Ripple is an example, or other pea soy protein blends that do have similar nutrient um, contents listed on the labels. What is challenging here is that we know from research that our bodies are not as able to readily absorb these nutrients from plant-based sources as they are from animal-based sources. And there is still a real lack in the data on bioavailability of many of these nutrients from plant-based milks. Even in digging into some of the research on soy milk, there's some research out there suggesting that the protein and other nutrients are not as readily absorbed by our bodies. So not to say they're a terrible substitute. We recognize that there are cases in the source of dairy allergy or other medical conditions where these are a necessary part of the diet and or maybe warranted used in place of dairy milk. For families with lactose intolerance, because we want to encourage them getting the nutrients that are found in cow's milk, we encourage that they first try the lactose-free versions of those products. If they can't tolerate them, then plant-based milk alternatives might be a good fit. But the bottom line here that I mentioned earlier is that a lot of families weren't aware of these nutritional differences. And when we did our focus groups, we actually heard from many who thought almond milk had more nutrients than cow's milk, or almond milk was the one that came up the most, which is funny to me because it's one of the least nutritionally adequate plant-based milks out there. So if you're an adult and you want to swap this out for dairy milk, you've finished building your calcium stores, go for it. But for young children and adolescents who are still actively building their calcium stores and working on developing bone health, it is really important that they have adequate sources of vitamin D and calcium. And we know cow's milk is a cheap, readily available, easy way to do it. That being said, it's also completely possible to have a nutritionally adequate diet without any dairy or cow's milk included. And in this case, we recommend that families work in consultation with their pediatricians and a dietitian to make sure that their kids aren't experiencing nutrient shortfalls if they are avoiding these products. So the biggest reason they're in the limit is a lot of families were just doing a one-to-one swap and did not realize how much their kids were missing. And we are seeing a growing number of case studies and other evidence in the literature to support that.
Thanks, Megan. Great question, Christina. Thank you. And that was great. I didn't realize a lot of what you were sharing, so I'm learning a lot. So thank you, and I'm sure others are too. So keep your questions coming. We have time for maybe just a couple more before we wrap up. Another question that I have here, and I think maybe there's been some touching on this, but I know a lot of teenagers are, kind of buying their own drinks. So parents might not be around. How could parents, have an influence or help them with avoiding, some of these like sugar sweetened beverages, energy drinks, the ones with the no calorie sweeteners, et cetera?
Yeah, what was fascinating when we did the groups with the tweens and the teens was that they were really on board with these recommendations pretty early on. So when we talked about what they should be drinking, they all were like, yes, this makes sense. We're doing this. A lot of days schools are asking kids to bring water bottles, or the trend is to carry water bottles all day with them at the school. And so we are hearing in our focus groups, at least, and through our other outreach, that a lot of kids are drinking more water. And when we did the focus groups, just this reminder of how important that water is to them, they said was really positive reinforcement of their need to drink more water. They also weren't surprised about any of the things we were saying were in the no category when we talked about them conceptually. But when we said, we'll start naming brands of products that you are drinking and whether you think they're healthy or not, we did not see that knowledge transfer to the product. And so I think whether it's parents or teachers or providers, influencers, can really make a big difference is educating kids on some of these products in more detail and helping them to make decisions. So when we talk to kids, there's a big movement right now on sleep health, for example, and how important sleep is, not only for growth, but also for academic achievement and mental health, et cetera. When we took that angle with them and started talking about all these beverages with added sugar and caffeine and how these were so disruptive to their sleep quality and sleep duration, they were really receptive to that. So finding ways to educate them on the impacts of some of these choices, on not just the long-term health benefits, because while I know we're all working on things like chronic diseases and obesity, they're thinking front and center right now, cavities, sleep, weight, um, concentration, like how do we help them focus on the short-term immediate impacts? And when we started talking about those pieces in the focus groups, there was a lot of excitement and a lot of like, oh, I had no idea Celsius had this much caffeine and it's marketed as this like natural caffeine, but it's not. And so what does that mean? I shouldn't be drinking 5 a day. Maybe I should just be drinking 1 a day. It's still a huge win for that individual child. And so also thinking about how we frame success with them. They don't have to go from all to nothing, but how do we gradually make healthier choices to move to be more in line with these recommendations?
Great. Thank you so much, Megan. Awesome. So I think we are getting to the end of our time together here. So I want to just say thank you to everyone for all the awesome questions and comments that you've shared in the chat. And real quick, before you head off for the day, I just wanted to give a friendly reminder that you can join our Choices Community of Practice online portal. It's free to join, and we'll pop a link in the chat. You can access plenty of resources there, including our member directory, which is a great way to connect with other people in the community of practice, see what other people are working on and where they're at. So we really appreciate you sharing that. There will be a little post-event survey that's going to pop up on your screen after this. So we encourage you to take a few moments to just share your feedback and ideas for future coffee chat topics. We're always looking to take those into account for our planning for future events. And again, a friendly reminder, we recorded today's session and we'll be sharing that. We will also be sharing what we call a resource roundup. So a little document with all the different amazing resources, the recommendations and provider and partner toolkits that Megan was referencing. We will be sharing all of that out after today's session. So please be on the lookout for that. Thanks again, everyone, for joining us this afternoon. And thank you again so much, Megan, for such an awesome presentation. We learned so much about the recommendations today. So thank you. And thanks, everyone.